Good morning and welcome. We are here live from UCLA, and I am joined today by two amazing queens. Queen Latifah, who is right next to me, who actually, her mom suffers from heart failure, and Dr. Watson, you specialize in heart failure care
And prevention.
and prevention. And so we basically want to just really open up the dialogue with the American Heart Association, whose goal is to really bring awareness to what causes it, how can we prevent it, what are the signs, right? Especially on a special day like World Heart Day, right? World Heart Day, we got two amazing women with big hearts next to us. So we really just want to open up the dialogue. We know we're live on Facebook, so please send us your questions. This is actually a discussion that's going to be happening all day. There's two more panels happening after this, but we're kicking it off with Queen Latifah because this issue really hits close to home. It's, as she was saying earlier, it's real. So can you tell us a little bit, Queen, about heart failure and how it's really touched so close to home for you?
Well, it's it's kind of amazing because my mom is how this whole thing entered my life. I'd heard of congestive heart failure before, maybe when my grandmother was much older and dealt with heart issues, but never anyone young. And my mom was pretty young when she received the diagnosis that she had congestive heart failure, and it was a big shock to us. She taught high school and she was teaching one day and she passed out in school. I think this was maybe her second time like fainting, but this time they brought her to the hospital, and after the doctors ran tests, the doctor told us, what you have, Rita, is congestive heart failure. So when you hear something like that and your mom is in her early 50s, you're like, what?
Yeah.
What do you mean by this? Because it sounds really scary. And so once we got over the initial shock and fear of those words, it was really about, okay, so now what do we do? Where do we go from here? And that's when we started to learn that there were a lot of things we could actually do, and there were a lot of places to go from here. So it wasn't like a death sentence, and that's one thing I wanted to say first. It was very fearful to hear, but once we started talking to the doctor, talking about different medications she could take, how we could make lifestyle changes, simple things, not hugely complicated things, but really just things like cutting the salt out of your diet, and how you didn't want to retain fluid and things like that. We basically started to become educated, and we were able to change our entire family's lifestyle, because if she had to change it, we're all going to eat at the same time, and we were able to start doing that, and her heart began to improve.
Yeah.
So it's really this being involved with the American Heart Association through Novartis is really important to me, because they're getting the information out there about heart failure and the small changes you can make in your life to either prevent it or manage it. And of course, the people who are around that patient, the family members, and how we go through things and what we need to kind of, stay on our own 2 feet while we're taking care of someone we love so much. So it's been quite a journey.
And I think a lot of times we feel as human beings like it'll never affect us. It
Right.
will, we're untouchable, right? But then there's signs. There's signs that you say, no, it's just more than fatigue. It might be something else, right?
Yes.
So Dr. Watson, what exactly is heart failure? Because it's one of the most misunderstood conditions out there.
So heart failure is any condition in which the heart is not able to pump sufficiently to get all the blood your organs need. So it could be due from a heart muscle that's too weak. It could be due from hearts that are too stiff. It could be due from a lot of things, but the ultimate result is you can't get the blood to the organs that they need. And so you get fluid building up in your legs or your stomach or your lungs, things like that.
And why is World Heart Day for you especially so special? And you really back up this initiative, because that's really what it is. It's the second year that this initiative is in full force. We wear the red socks, and it's really
What, these old
a
things?
movement. It's really a movement at the American Heart Association with somebody such as yourself. And we do live in a pop culture world where when a celebrity like you stands behind something, more people want to want to believe in it and say, oh my gosh, maybe I should get educated too. So why is today World Heart Day, besides you having a big heart, which we all know that?
That is the reason.
Yeah, why is it so special to you?
Well, I think it's very special to me. World Heart Day, just the idea of it. It should touch your heart in some sort of way. Also, I mean, our heart is our life. This is what we need this thing to beat so we can live. I mean, we're here at UCLA Medical Center, and my mom's birthday was yesterday, and she was admitted here last night.
So it's real.
Yeah, she was admitted because she needs to get some, as the doctor was saying, she needs to get some fluid off. And this is something that can only be managed in the hospital. And so she's here. Luckily, this is where we come. This is what we do. So we're all prepared to do this, and we actually are geared up to get this fluid off. This is kind of an exciting thing for us because we know once we get that fluid off, she's going to feel so much better. Her heart is going to work more efficiently. She's going to breathe better. Her spirit is going to come back up because she'll feel better, you know. And so I know a lot of families. We're talking about 6 million people in this country who are affected with heart failure, and all those who surround them. And that's millions and millions of people. So this affects all of us in some sort of way. It can affect a lot of us. More importantly, had my mom known about what the symptoms were, she probably would have been able to prevent a lot of it before it happened. And so the more we can make people aware of what to look for, or the small changes they can make in their lifestyle to prevent this from happening, then, we all have a chance of making a big difference. And that means a lot.
Yeah, definitely. So being that you're so close to your mom, right? Do you feel, I mean, it was a shock to the family. Do you feel like this has been like a blessing in disguise for your entire family? Because maybe if this wouldn't have happened, if this wouldn't have been brought to the surface, you guys would not be aware of your salt intake. Do you feel like it's been a blessing in disguise for your entire family?
I do feel that there have been blessings for sure through this situation. I mean, I don't think anybody would say, hey, be blessed by being diagnosed with a disease or an issue like that. But I tell you, we're a family of faith. We really believe in God, and we've watched the miracles that have happened through this entire situation over the course of years. We have watched our family come together. We've watched us, whether it's myself, my sister, my best friend, my manager, my cousin Tina, my aunts, so many people, my dad, we've all rallied around, and you've seen the best come out of people. And you've also seen when we get weak and how we try to lift each other up. You know what I'm saying? And more importantly, lift my mom up, who has like the best attitude and the best spirit probably of all of us, and the hugest amount of faith. So she's inspired us so much. And we kind of just inspire each other, and we get to, we've learned so much. We swear we're nurses and doctors around here. We've been so educated over this, but more interestingly is how we all manage to run into people who say, oh, I heard about your aunt, or I heard about your mom, and, someone in my family has this, and this is what my mom went through, or this is what my dad was going through. Or, people appreciate having, relating to someone else and knowing someone, they're not alone in this, they can connect to someone, who's going through it.
Yeah, Lisa.
Jump in whenever you want,
Yeah,
Dr.
no, you're
Watson.
absolutely right. And I think you said so many important things. You talk about how the whole family has rallied around. Heart failure is one of those things that doesn't just affect one person. It really affects the whole family. And the nice thing is that there's so many preventive and treatments that can be done by managing things like salt, exercise, diet, activity. And so you make perfect points. And I love that your whole family has rallied around this because it's so important.
I don't know what I'd do without them.
Dr. Watson, how do you know when you're at risk for heart failure? Are there symptoms? Are there signs that we should be aware of, right?
Right. So we're all at risk. So no one's untouched by this disease. So we have to all consider ourselves potentially at risk. But there are certain symptoms. And there are things that some of them are really specific, but some of them are non-specific, like unusual fatigue. Haven't you felt them?
I'm feeling it right now.
Weird shortness of breath, difficulty walking. But when you see a change, there's something going on. Check it out. So
Because the body really talks to you, right?
the body does.
But I think as a lot of times we don't want to get older, we don't want to age. We're like, oh, it's just me getting older.
Right, the body's talking, we're not listening. So we got to pay, and that inner voice in you that tells you something's wrong.
Yeah.
You're not just getting old. We're pretty resilient people. The older we get, we tend to do okay.
Right.
If you see a definite change in your activity, you're not able to do the things you used to be able to do, or if you're not doing the things that others around you seem to be doing just fine, definitely get it checked out.
Yeah, Queen, did your mom ever take her signs of heart failure as like, oh, it's probably me just getting older? Did she ever confuse the two?
My mother was a high school teacher. Okay. So absolutely. My mother thought, okay, I'm teaching,
These kids are
classroom of
stressing me
30
out.
kids a day. Yeah, and I have 2 kids of my own. She's part of our flavor unit company, so she was always helping us out. So I think she just thought she was just really tired, but I could kind of hear it. I didn't know what it was. I just knew that she sounded unusually tired, maybe a little more irritable, because she's usually so bouncy and bright and funny, and I could hear something. I didn't know what it was, but I could hear that she probably wasn't feeling so well, and I wish we had known, that it could be that sort of change. So yeah, I think that if she had known what to look for, she might have caught it sooner. But catching those symptoms is really important, because right now, someone who's watching this may realize that they can't really sleep flat anymore like they used to. Or, they go up a flight of stairs and they're way more winded than they used to be, or their legs and ankles are starting to swell unusually, consistently maybe even, and won't kind of go away. So those things are, and you can correct me if I'm wrong.
Absolutely correct.
I got the pro here, but when you start noticing things like that, then even those things can be overlooked with life, how we just go through life and we don't stop sometimes. We're just taking care of what we have to take care of and doing what we have to do. But, okay, this is a little too frequent. Maybe I should go to the doctor, and don't be afraid to go to the doctor. We go to the doctor sooner rather than later. Doctors are our friends. We want to become buddies with them. We want them to know our bodies so well that they can even tell when something's different, because sometimes I can look at my mom and see how she's feeling. So, I know if doctors have a rapport with their patients, they can kind of recognize things as well, and get on the phone and call them and tell them when things aren't, something's not looking right, so that they can treat you professionally. Stop trying to diagnose everything at home. Get in there and talk to a professional and talk about it and see, ask a lot of questions and be inquisitive, kind of take control of your health.
Yeah, absolutely. Your health is your responsibility. I've always believed that 100%. We have a couple of people checking in on Facebook. Lisa C., Angela M., Gay, Jim. They're saying some of them have even lost a family member to heart failure. So yeah, this is definitely a real issue. And that's what today's about. It's really about opening that dialogue. You don't want to go to your doctor and lie to your doctor about what you're feeling, because you're really lying to yourself.
And I don't think most people lie, but
Some people do.
Some people do, because they're afraid of the truth.
But and also many people are used to caring for others. It sounds like your mom was taking care of everyone. I bet the dog got taken care of before she thought about herself.
Definitely.
So sometimes we minimize things or we explain things away. And I think that the one thing I'd like to get out to people, there's anything that seems a little off, don't wait. Get it checked out.
Right.
Yeah, so are there certain foods that can trigger heart failure? Is there something specific that you can say, if you do this or if you do that, this is going to create heart failure?
It's not going to trigger heart failure necessarily, but it will worsen it. And you hit the nail on the head. It is salt, salt, salt. Number 1 through 9 are salt, and number 10 is C1 through 9. So salt. Too much salt will cause you to hold on to more water, making your heart work harder to try to get rid of it. So
what would you say is like the daily sodium intake we should be doing?
Well, it's going to be different for everyone. So everyone should talk to their doctor. But for most patients with heart failure, we say definitely not more than 1,500 milligrams of sodium a day.
So what's that, like a teaspoon?
It's not a lot. It will, and you will taste the difference
visually
when you first do it. but you will get used to it. Honestly,
Yes,
our
you
taste
do.
buds have been kind of taught
Yeah,
to
they're
really like
trained.
salt.
Yeah, because that sounded crazy. When our doctor was like, about a teaspoon for the whole day. You're like,
What?
but then when you start adjusting your diet, this is also something that as a layperson, I want people to know that you don't have to do everything right away. If you have time, you can like work your way into it. Your taste buds do adjust. And now, what we thought one might have been not salty enough, we find the flavors in the foods. The
Yeah.
food has flavor. You're putting salt all over it. But once you start to adjust, you put too much salt in your food, everything will be salty to you. And you realize
Yeah.
you enjoy food without all that salt on it.
Do you implement your mom's good eating habits now into your own life?
Yes, I did. I mean, I kind of was eating like that a bit before my mom even got this diagnosis, because I've spent so much time in California that it's a lot easier to eat healthy, like to go
Yeah.
get healthy fast food. But I think the country is catching up, because people are wanting more healthy, organic, natural kinds of foods. People are wanting to eat healthier. People are creating more restaurants and menus that
Yeah.
even fast food joints are making menus that are kind of healthier. So our options of what we can eat out there that's healthy is growing. And so we can make those choices and still kind of have the things we want. But yeah, my mom, she came right along. And there's just certain things I know she's going to want. And I think she can have those things as long as it's within reason, within a balance. And, and it's kind of planned out. You can't just have everything you want every day. But you can't deny yourself, everything
Right.
as well, because it just makes life boring. So you have to strike that balance. And she's the boss at the end of the day. All we can do is kind of make suggestions and support her. And at the end of the day, she has to make the final decisions because it's her life. And that will be the case with every patient who goes through this. But 9 times out of 10, she'll make the right decisions because she gets the whole big picture and she
Yep.
loves us. But every once in a while, she got to have, some oxtails with some rice and beans, some mac and cheese and some greens. Throw it with some, you know what I mean? And just get it from the spot. Don't
Yeah.
tell them. So we usually order things and we're like, no salt, just no salt. And we found a lot of new foods by exploring
Absolutely.
who makes good foods with no salt.
Yeah.
And Dr. Watson, you were sharing with us earlier that UCLA has a motto, right?
Well,
you guys like to share with all your patients.
Our preventive cardiology program and our Women's Heart Center have a motto: move frequently, eat thoughtfully, connect deeply. So
I like it.
And those really are 3 really essential components of a healthy heart and a healthy life. So we want you to continue to be physically active, as your mother should be as well, because even with heart failure, we can all walk,
Yep.
we can hike, we can do things that will keep us moving. Think about what we eat. Again, we're not always going to be perfect eaters,
Right.
but we're always going to try to eat the right thing and limit the things that we know are bad.
Right.
And then the strong social connections that you and your family obviously have, those are the things that keep us healthy.
Yeah, I love that.
Say the motto again. I like that. I need
Yeah.
that's going on my wall because I get knuckleheaded sometimes and I need a good stern talking to.
Move frequently,
Move frequently.
eat thoughtfully,
Eat thoughtfully.
connect deeply.
Connect deeply.
Connect deeply.
And it's true because we're out there helping the whole world, but we really forget about ourselves sometimes,
Exactly.
right? And we had a comment from Jim C, checking in, saying that he works out 6 times a week, lifts weights, has a heart failure. He's 40 and he's afraid. So what would be the wake-up call that, Queen, you want to let the audience watching know? And you too, Dr. Watson, like what would be the wake-up call right now of somebody that maybe has a feeling like maybe I do have something is not right in my body? What do I do? I'm afraid.
Well, Jim sounds like he already has heart failure, but he's living a full, wonderful life. So it sounds like he's a part of a health system. He has a doctor and a team that's surrounding him, and he's doing everything right. And he's not afraid to, well, he says he's afraid, and I believe that.
Right.
But I want him to know that everything is being done for you if you're in with the right doctor, and you should continue to live your life.
Definitely live your life. And go to riseabovehf.org. I mean, there's a lot of information on there that will help to support you, help to support those emotions. Those feelings are important. It's okay to be afraid. And there's a lot of support out there if you seek it.
Yeah.
There's a lot of people who can relate to exactly how he feels and would be more than happy to have a conversation with him about how he feels, because they may feel the same way. But yeah, keep living.
Yep.
Keep
You know,
living,
keep
yes.
living.
And,
And
you know,
connecting will help him as well.
See?
thank you, Queen.
Connect deeply.
Thank you, Dr. Watson. And remember, these discussions are going to be happening all day today on this channel. Thank you to UCLA for allowing us to be here, the American Heart Association. And just remember, like Queen said, you're not alone. You're not alone, and there is guidance, there is help, and there is resources. So thank you, guys. And we'll have another discussion again soon, hopefully next year.
That's right.
Yes.
Don't forget to let me see your red socks somewhere.
Socks.